Hi, I'm McKenzie Hoeger, and I am a diagnostic medical sonographer or ultrasound technologist here at St. Luke's Cedar Rapids UnityPoint Hospital. When I chose to go into ultrasound, I knew that I wanted to do something in healthcare, but I wasn't exactly sure what. I knew about doctors and nursing, and my mother was actually the one that pointed out to me to look into radiology, which is our imaging for healthcare. I looked at X-ray, CT, ultrasound, and ultimately ultrasound was the most interesting to me. I attended University of Iowa's program for ultrasound, did 4 years and got my bachelor's of radiation sciences. And in the program, you choose between 2 different ultrasound tracks. One is the cardiac and vascular, where you scan ultrasounds of the heart and of arteries and veins, or of general vascular, where you get to scan everything in the body except for the heart and then arteries and veins. I chose general. That's what interested me, and I really enjoy the variety of the different exams we do. Some of the exams we do are right upper quadrant ultrasounds, where we look at the gallbladder for stones or diseases. We look at the liver a lot with it for diseases such as cirrhosis or hepatitis. We look at veins in the legs and arms for blood clots, and we'll look at arteries as well. A common arterial exam we do is the carotid artery to evaluate for symptoms of stroke. We also do what most people know ultrasound for, which are the obstetric or pregnancy ultrasounds. And with that, we look at baby at different points of the pregnancy. The most common exam people know about is the exam that we call the anatomy survey, where we look at baby from head to toe. And people know about it because it's usually when they find out if they're having a boy or a girl. At that exam, we're looking at baby, like I said, from head to toe, actually evaluating the brain, the structures of the heart, the internal organs, to see if we can rule out any diseases before baby is even born. One of the things that I love about ultrasound is how closely I get to work with my patients. Healthcare is very rewarding, very challenging, but very rewarding. And it's one of the reasons I chose to go into this field, is to be able to work with my patients every day. One thing I would say for you as students is definitely job shadow. Without job shadowing, you're not able to see firsthand glimpse of what a career looks like day to day. And without that, you could potentially choose a career that maybe isn't the best interest for you. Back to my schooling. So I did the University of Iowa, did 4 years, have my bachelor's in radiation sciences. And when you're looking for schooling for ultrasound, you want to be sure to ask, is it an accredited program? What's job placement look like when you graduate? And while in the program, where do you all rotate for clinic? For University of Iowa's program, we went to 6 different hospitals, and I know they actually have more rotations now, as we actually get to work with the students still. And it's very important to know those things, so when you get hired, you want to be more hireable by having more ultrasound experience in different areas, such as pregnancy ultrasounds, abdomens, vascular and arterial exams, breast ultrasounds. The more you have under your name, the more hireable you'll be to different hospitals and clinics. I want to say good luck to you in choosing what you choose for your path as careers. I'll give my information so that way you can access any information I have for you through my email. And good luck to you as students.